Hey guys, it's Dr. Potter. So I promised that I would come back and talk to you about some of the headlines recently, which said that insurance companies had taken action to improve the prior authorization process. So first of all, I want you to know that whenever I try to speak to you about something like this, that I really do take the time to do my homework. So I've read the statement, obviously, from the insurance companies. It was from their lobbying group, AHIP. I have watched the entire press conference that was held with Robert Kennedy and others announcing sort of the government's take on this. And then I've actually also gone back to a lot of the sources that were cited in the insurance company's statement so that I could really intelligently kind of speak to you about this promise that was made. So first of all, I'm appreciative of the fact that people recognize that we're at a boiling point in our society where we have to address insurance problems. So I guess that's a positive here. And I appreciate that the administration is trying to come up with a way to do that, and that working with the insurance companies is something that they chose to do in this instance. Okay, so I've looked through the entire statement, and first of all, I just think that it doesn't land. The statement from the insurance companies really promises to do things that they've been promising to do for years and haven't done yet. And then there's really not a lot of like concrete deliverables that they're saying that they're going to reach. Importantly, this entire statement and press conference is about a voluntary promise that insurance companies are making, and there's really no defined repercussions if they don't do what they say. So this is not a mandate. This is not legislated. There are no new rules that have been made that are going to hold these insurance companies to the fire to make sure that they do the right thing. So I'd say overall, that really makes me think that, it's just a lot of talk, right? So then when I compare what was said in the press conference to what was written in the statement, I also think, more of the same, right? So there was a lot of fanfare made in the press conference about, this is really going to revolutionize prior authorization and be so much better for patients. But when you read what the insurance companies are actually signing, not what they're saying, there's no deliverable. There's no actual numbers that we can follow and measure. And I just don't know that we're in a position in our society now where we're like up for trusting insurance companies, right? I think what we want from our government is protection of Americans and improving healthcare. And I don't think that accepting a promise from insurance companies to do better around prior authorization really delivers what Americans have been demanding. So, I think that additionally in the statement from the insurance companies, there's a tone of blaming doctors. There's a tone that insurance companies are saying that they have to have prior authorization in order to protect patients because, from fraud and abuse by doctors. And I don't think that insurance companies really need to be playing the protector role. I think that they need to be, delivering what they've promised to deliver in terms of the insurance product, right? So that also doesn't land with me. I invite you to read through, the entire statement from the lobbying group AHIP. It's just a pinky promise. There's no teeth behind it. I don't have a lot of faith that anything is going to be very much different. And I guess I'm skeptical. But I do think that we'll be able to reference this in the next 6 to 7 months and see what insurance companies actually do. But yeah, I'm sorry that I can't deliver a better report to you, but I'm disappointed that there wasn't actual legislation and rulemaking around prior authorization, that our industry, that we didn't demand that from them. But we'll follow closely, and I guess we'll see if they live up to their promises. I think we all know that that's unlikely.